So, good day, everyone. We are the Group 3 from Nurse 3H, and we are going to discuss the Republic Act 10173, or also known as the Data Privacy Act of 2012. So, before we begin, let me introduce to you the reporters for this topic. So, we have Miss Barete, Miss Dano, and yours truly, Miss Pacot. So, before we begin, let me ask you something. Have you ever worried about your personal information being leaked online, like your passwords, your medical results, or even just your phone number? Imagine if that happened to a patient's private health data. It's scary, right? That's why the Philippines created the Data Privacy Act of 2012. So, when you hear the words data and privacy, what comes to your mind? Maybe you think of passwords, social media accounts, or even your bank details. But in nursing, social media means so much more. It's about protecting the very personal information of our patients, like their medical history, their lab results, and even conversations we have with them. So, just like these illustrations, it shows us how wide the scope of data is, from personal basic details to very sensitive health records, which all of this must be safeguarded under the Data Privacy Act, because one simple leak could harm not just the patient's trust, but also their safety. So now let us define what is Data Privacy Act of 2012. So this is a Philippine law that upholds the right to privacy by regulating the processing of personal data in government and private institutions. So in other words, this law was created to protect the privacy of every individual by regulating how personal information is collected, stored, and shared. So, in simple words, it makes sure that our private details, such as our names, addresses, health records, and even online activities, are safe from misuse. So, now what is its purpose? So, the main goal of this Data Privacy Act is to strike a balance. So, it allows organizations, including the hospitals and healthcare facilities, to use information when needed, but at the same time, it protects individuals from data breaches, identity theft, and other risks. So, for us in nursing, the purpose is very clear. We handle sensitive patient data every day, and the law reminds us that protecting this information it's not just a responsibility, but also an ethical duty to maintain the trust of our patients.
Good day everyone, again I am Barete. So patient data privacy and security is very important in healthcare because it protects sensitive information and builds patient trust. So let me explain this further. First, RA 10173 or the Data Privacy Act ensures that patient information in electronic health records is fully protected. This law emphasizes that every piece of information must be treated with confidentiality. To make this protection possible, different security measures are applied. Examples of these are passwords, encryption, and access control. These measures allow only authorized personnel to access the patient's record and help prevent unauthorized use. Aside from protection, this is also a way to track data use, and that is through audit trails. Audit trails help monitor who access or edited patient records. This promotes accountability and provides evidence in case there are issues in data handling. And finally, all of this will not be effective without the active role of nurses. As nurses who are responsible for keeping patient information confidential, educating patients about their data rights, and reporting any suspicious activity in this way, we become guardians of both patient care and patient trust. Next, we will talk about informed consent. This is an essential part of healthcare because it ensures that patients are fully aware and agree to how their personal data will be used. Let me explain this further. Transparency is the first principle, which means patients should always know how their information will be collected, stored, and shared. This helps build trust between the patient and the healthcare team. Connected to this is the principle of consent. No patient data should be used without their clear approval. Respecting consent is also respecting the patient's right to control their own personal information. In line with this, changes in practice have also been observed. Today, hospitals are already using both written and digital consent forms. This is especially important now with the rise of telehealth and other digital health services. Lastly, let's highlight the role of nurses in the process. As nurses, it is our duty to explain clearly why patient information is needed to make sure the patient fully understands and obtain their consent before any action is taken. This ensures ethical practice and ethical patient trust.
So, hello everyone. Today I will be discussing data governance and accountability under the Data Privacy Act of 2012. So, this focuses on how personal information should be properly managed, protected, and used responsibly, especially in healthcare. So, first, you have your appointment of DPO. So, the law requires every hospital or healthcare facility to appoint a data protection officer. This person oversees compliance with the Data Privacy Act and ensures that patient data is always protected. Next, proportionality principle. So this principle reminds us to collect only the information necessary for patient care. For example, health history and allergies are important, but unrelated personal details should not be taken. Then lastly, nursing informatics role. So nurses play a big role in data governance. We help by monitoring compliance, reporting any possible breaches, and guiding colleagues on proper handling of patient data. So now I will discuss professional practice and ethics in relation to the Data Privacy Act of 2012. So this part focuses on our responsibilities as healthcare workers to handle patient data with honesty, confidentiality, and professionalism. So now let's talk about confidentiality. One of our key ethical duties is confidentiality. Patient information must not be shared with anyone outside the care team, not even in casual conversations. Next, integrity of patient data. We must also keep patient records accurate and reliable because errors or incomplete notes can lead to unsafe care. Then lastly, modern application. Even in telehealth, mobile apps, and digital platforms, the same ethical standards apply. We must ensure that data is secure and avoid careless sharing.
Alright, so we have already seen how the Data Privacy Act provides guidelines to protect personal information, especially in healthcare. But in reality, applying this law in our daily practice is not always easy. So in this section, we'll talk about both sides, the difficulties we face today, and the future improvements that could help us provide a safer, more secure, and more patient-centered care. So let us start with the challenges. So one big challenge is that not all nurses receive proper training in informatics or data privacy. So sometimes we focus more on direct patient care and forget that handling information is just as critical. So another issue is the weak information technology infrastructure in some hospitals because then again, without strong systems, data becomes more vulnerable to leaks and breaches. And of course, there's always the fear among healthcare workers of unintentionally violating the law and facing penalties. However, these challenges also shows us the direction where we should be moving toward. So So, for example, providing more training for nurses in informatics and cybersecurity can help us become more confident in handling digital patient data. And also, hospitals can strengthen their information technology systems and security protocols to match the global standards. And finally, as technology keeps changing and evolving, like the telehealth, mobile apps, and AI, our laws, including the Republic Act 10173 or the Data Privacy Act, may also need to be updated to stay relevant and effective.
In conclusion, the Data Privacy Act of 2102 is very important in protecting patient information, especially now that healthcare is going digital. This law reminds us that patient records are not just data, but part of their dignity and trust. As nurses, we have a big role in keeping this information safe. We are expected to respect confidentiality, follow ethical standards, and make sure that patient understands how their data will be used. Finally, the call to action is clear. We must always be responsible and professional in handling patient information. By doing this, we protect not only the data but also the trust and safety of the people we care for. So, I will be sharing the question and answer portion of our report. These questions are based on the key topics of our discussion, and the answers will help us understand how the Data Privacy Act and Nursing Informatics are applied in practice. Let us now proceed to the first question. Question 1. How does RA 10173 or Data Privacy Act of 2012 influence the use of electronic health records in nursing practice? So, the answer is RA 10173 requires the use of security measures such as passwords, encryption, and access control in EHRS. It also mandates audit trails to track data access. Nurses are responsible for ensuring that patient information remains confidential and protected from unauthorized use. So let's proceed to question number 2. How do nurses apply the principle of transparency when obtaining patient consent? So the answer is nurses clearly explain how the patient data will be collected, stored, and shared. They make sure patients give consent either in written or digital form before any healthcare procedure or telehealth service. So let's proceed to the last question. Question 3. What is one major challenge and one future direction for data privacy and nursing informatics? So the answer is a major challenge is the limited training of nurses in handling digital health data. A future direction is providing more training programs in nursing informatics to strengthen their skills in data privacy and cybersecurity. And that's all. Thank you.
All right. So as we end our discussion on the Data Privacy Act, let's take a moment to reflect. So we have seen that this law, the RA 10173 or the Data Privacy Act, is more than just a law. It is a reminder of how important trust is between nurses and patients. So every time we handle health information, we are not just managing data. We are protecting a person's dignity and safety. So, but then challenges remain, such as limited training, weak systems, and the fast growth of technology. So these challenges shows us that data privacy is not just a one-time lesson, but it is something that we need to keep learning and adapting to as future nurses. So now I'd like to open this up with a few questions for you guys to think about. So first question, in your opinion, which is harder? Which is harder to protect? Paper records or electronic health records? And why would you say so? Second, what might happen if a nurse accidentally violates Republic Act 10173 or the Data Privacy Act, and how can this affect the patient and the nurse? Lastly, do you think Philippine hospitals and clinics are fully prepared to follow this law, the RA 10173 or the Data Privacy Act, in the digital age? Why or why not? So these questions aren't just for discussion. They are a way for us to connect this law to our future roles. Because at the end of the day, being a nurse means caring not only for a patient's body, but also for their personal and private information.